How to reverse tooth decay naturally. People are exposed every day to foods and beverages that take a toll on your teeth. Even with the best oral hygiene, your teeth will always suffer from some sort of demineralization, which leads to decay. If you want to reverse your tooth decay, there are some natural and home remedies that can help you. Method 1: Using natural toothpaste. 1. Look for the right ingredients. If you want to help reverse tooth decay naturally, try looking for natural toothpastes. These toothpastes contain a combination of all natural ingredients, which accomplish the same thing as fluoride. They work by reducing the bacteria in your mouth with xylitol, a sugar alcohol that reduces how much plaque-forming bacteria attaches to your teeth. These pastes also contain calcium and phosphate, which are lost during demineralization of your teeth. Common commercial natural brands include Redmond Earthpaste, Dr. Collins Restore, Apogard Premio, Tom's of Maine Cavity Protection. 2. Make your own toothpaste. If you don't want to buy your toothpaste, you can make your own out of natural ingredients. Start with 4 tablespoons of calcium carbonate powder, which come as tablets or powder. Mix it with 2 tablespoons of baking soda, 1/2 to 1 packet of stevia or xylitol powder, and 1 teaspoon sea salt. To the dry mixture, add enough coconut oil to make it into a paste. Next, add a few drops of peppermint oil to help freshen your mouth. Mix the ingredients completely. To use this mixture, just dip your toothbrush into the paste and brush like normal. You can make this in bulk and seal it in a jar to use over time. To avoid any possible spoiling of the ingredients, keep it in your refrigerator. 3. Add whitening to your toothpaste. You don't have to do without whitening if you make your own toothpaste. To make your toothpaste whitening, add 2 teaspoons of 3% hydrogen peroxide to the toothpaste recipe. When you use it, there will likely be foaming and perhaps some tingling, but this is how it should feel in your mouth. Hydrogen peroxide works as a bleaching agent and is also antibacterial. Don't use anything stronger than a 3% solution. The stronger concentrations may burn and irritate your mouth and gums. 4. Try oil pulling. In addition to normal brushing, oil pulling can help reduce bacteria in your mouth. First thing in the morning, take 1 tablespoon of coconut oil or sesame oil into your mouth. With your mouth closed and without swallowing, swish the oil around in your mouth, getting between your teeth and around your mouth. Continue for 15 to 20 minutes. After you're done, brush your teeth normally, then drink 2 to 3 glasses of water. Do not gargle the oil. Make sure you do this before you have eaten or drank anything in the morning. This method has not been tested to see if shorter periods of time are beneficial, so try to perform it for the full length of time. Method 2: Using diet and nutrition. 1. Avoid all sugar and processed starches. Sugars create food for bacteria, causing plaque, which then causes tooth decay. Processed starches work in the same way as sugars. Avoid all processed and pre-packaged foods, including snacks, cakes, breads, chips, cookies, and crackers. These foods contain a lot of added sugar. Always look at the label, even if you think something is healthy. If sugar, cane syrup, high fructose corn syrup, or another artificial sweetener is listed in the top 5 ingredients, do not eat or drink it. Sugar is a major component in sodas and other sweetened drinks as well, so avoid those when you can. Plus, the extra, artificial ingredients in sodas break down tooth enamel. If you need a sweet fix, try honey, which is antibacterial, and the natural, calorie-free sweetener stevia, which is an herb 200 times sweeter than sugar. 2. Eat citrus fruits in moderation. Citrus fruits have a high acid content, which leads to tooth decay. Because of this factor, you should moderate the amount of citrus fruits you eat, especially lemons, which have an extremely high acid content. If you do eat them, rinse your mouth out with water to help decrease the amount of acid that is left to sit on your teeth. Although fruit has natural sugars in it, the sugar is fructose, which is not as popular with bacteria. This means you can enjoy apples, pears, peaches, or any other non-citrus fruit without harming your teeth. 3. Chew your food properly. One way to help prevent tooth decay is with saliva production. To help increase your saliva production, chew every bite completely because chewing stimulates the production of saliva. Sour foods also tend to increase saliva production, but sour foods are also acidic, so avoid them if you can. 4. Take a mineral supplement. One way to remineralize your teeth is to put more minerals back into your body. To help with that, pick a daily multivitamin that has minerals in it, especially calcium and magnesium. Most people need at least 1,000 milligrams of calcium. Men older than 71 and women older than 51 should get 1,200 milligrams every day, so look for this amount if you fall within those age ranges. Also make sure the supplement has 300 to 400 milligrams of magnesium. 5. Get more vitamin D. Another way to increase the health of your teeth is to increase your daily vitamin D intake. Adults and children should get about 600 IU of vitamin D every day. Adults over 70 years should get 800 IU every day. Vitamin D and calcium work together to strengthen bones and teeth, so you can buy a supplement that includes both. There are multiple ways to get more vitamin D naturally, however, which include spending about 10 to 15 minutes every third day in the afternoon sun without sunscreen on your arms, legs, and back. Eating foods high in vitamin D, such as fish, soy milk, coconut milk, cow's milk, eggs, and yogurt. Method 3. Practicing good dental hygiene. 1. Brush your teeth. You should brush your teeth at least twice a day to help fight off tooth decay. When you brush, make sure you get the inner and outer surfaces of your teeth, the teeth in the back of your mouth, the chewing surfaces of your teeth, and your tongue. Scrub long enough that all the plaque comes off your teeth, but don't push so hard that you hurt your gums and teeth. Also use a soft toothbrush. Teeth can also be damaged by using toothbrushes with bristles that are too hard. 2. Leave the toothpaste in your mouth. After you brush your teeth, spit out the toothpaste like normal. Instead of washing your mouth out with water, leave the toothpaste remnants of your toothpaste in your mouth without rinsing. This gives the minerals in your toothpaste some extra time to be absorbed by your teeth. 3. Floss daily. Along with brushing, you should also floss every day. Start with around 18 inches of floss. Take the end of the floss and wrap most of it around the finger of one hand, leaving the rest around one finger of the other hand. Hold a section of floss between your thumb and your forefinger, gently guiding the floss between all your teeth using a gently back and forth motion and curving along the bottom of each tooth. Once the floss is between the teeth, use a gently up and down motion to get the sides of each tooth. After you do one tooth, unwind more floss and move on to the next tooth. Method 4. Understanding tooth decay. 1. Learn about teeth. Your teeth are a type of tissue made up of minerals with a hard exterior called enamel. The enamel covers dentin, which is softer than enamel. These layers protect the pulp, which is made up of nerves and blood supply to your teeth. This enamel can be damaged by bacteria in a process called demineralization, leading to cavities, tooth decay, and other dental problems. 2. Understand how bacteria affect your teeth. Tooth decay is caused by bacteria, which is prevalent on your teeth, gums, tongue, throat, and inside your cheeks. This is perfectly normal and helpful to overall health, but it can also damage your teeth and mouth if it becomes overgrown. These bacteria form colonies, called dental plaques, which feed on sugars you consume. The bacteria then produce acids that cause your teeth to decay. 3. Know the causes of decay. Your teeth will naturally demineralize if exposed to too much acid, the leading cause of the issue, as well as from bacteria. Major causes of decay include the formation of bacteria plaques, abundant ingestion of overly acidic beverages, such as flavored waters with added citric acid, sports drinks, and sodas, eating a lot of citrus fruit, such as lemons, oranges, grapefruit, and limes, gastroesophageal reflux disease, GERD, in which stomach acid can come back into your mouth, use of drugs such as methamphetamines, improper or inadequate dental hygiene, smoking, systemic inflammation or infections.